Hello everyone, this is Dr. Manoj Kutteri. In today's presentation, we are going to talk about role of gut in defining the human health. We have always regarded gut as an organ which is responsible primarily for digestion, absorption, and metabolism. But now, in my second slide, you will see that the importance of gut in defining the emotions through something called as a gut-brain axis. If you look at this, the gut is controlled by your brain, and there are 100 million neurons that are present in your gut mucous membrane. While the gut is handled by the neurological connection from the brain is also controlled by the various neurotransmitters that are secreted by your gut. And it is important to know that the moment we feel happy or we feel sad, it is totally controlled and decided by your gut microbiomes. The next slide tells you about how the gut is controlled or how our emotions are being carried out by the gut. You know from the third slide that there are various happy hormones or neurotransmitters that are produced which helps in determining our mood. The gut-brain axis is nothing but it is a connection, it is a crosstalk between your brain and the gut. And the various emotions that are controlled by your gut are your satiety, your sleep, your moods, and also your pain. The pain control can be done just by depending on the neurotransmitters that are secreted by the gut. How strange it is. Now you will see the happy hormones in the next slide, which are basically the four major categories of happy hormones or the feel-good hormones are serotonin, dopamine, oxytocin, and endorphins. And each one of them has a major functions in deciding our day-to-day activities. For example, if you look at the serotonin, it is responsible for your sleep, your brain functions, and it is also responsible for improving your digestion and also various other functions in terms of like feeling good or even your defining your circadian rhythm. The way that your sleep-wake cycle is completely handled by serotonin, which is one reason you know that serotonin production becomes very low if you are not really getting exposed to sunlight, which is one of the reasons vitamin D, we know that it is very crucial in determining your mood, or lack of vitamin or vitamin D deficiency can also cause depression, right? So these are very, very important factors. And although we consider serotonin as a brain hormone, as a neurotransmitter which is there in the brain, we need to know that around 80% of our serotonin production happens in your gut. And same with dopamine, about 50% of the production of dopamine happens in your gut. And these are the various neurotransmitters which are responsible in defining our day-to-day mood, the way we feel anxious, the way we feel depressed, the way we feel smile, or we become sad. All these things are totally controlled by your gut. By various food intake, you can actually just definitely have some kind of alteration in these effects. Now, in the next slide, you will also know that the gut also decides on immunity. Basically, the immunity, normally, when you talk about immunity, like there are two different aspects. One is about the defense mechanism in your body. And mostly we have innate immunity and there is something called as an adaptive immunity. The innate immunity is something that we are born with. And your gut plays a major role in defining your innate immunity. And normally, these are two different things. Like we talk about defense mechanism, which is basically regulated by various immunoglobulins in the body. We must have seen, like, during the time of COVID, like a lot of these immunoglobulins played a major role in improving your immunity. And we always talk about the IgG and IgE and things like that. So that is one aspect of gut. And the other functionality where the gut actually plays a role in immunity is the tolerance of the food. You know that there are so many foods which are allergic to human body. But like you have gluten, we have fish, lactose, then eggs, all these different protein. There are so many inflammatory proteins, especially the animal protein. And these things are better tolerated by your gut and there are certain neurotransmitters which are responsible for that, such as zonulin, and you have occludin. So these things also decide and determine the occurrence of other metabolic diseases, for example, like diabetes. Okay, so the modern research shows that zonulin, one particular inflammatory protein, is primarily responsible for not only type 2 diabetes, but even type 1 diabetes, which are actually just like mostly we consider that as a genetic trait. Now, the next function is basically about digestion, which is actually there on the slide now. So this is actually considered as the primary function of gut. And we all know very well about how the digestive processes takes place as well. There are different organs, the gut organs, which are actually playing a crucial role in ensuring that the digestion happens in a proper fashion. And for the sake of explaining the digestion, we can also split the gut into 3 different sections. You have your stomach, you have your small intestine, and you have your large intestine. And each of these, if you really look at it, there are certain mechanism in your body. Now, like gut immunity primarily rely on 3 major factors. One is the structural factors, which are basically controlled by the various single door valve, which only unidirectional valves, which actually just gets closed so that the food doesn't go back. For example, like you have a valve that separates stomach and small intestine, which means the digestion that happens in your stomach is contained. It doesn't really go down to the small intestine. And once it is completed, it opens the door to small intestine, and then it goes to the large intestine and gets eliminated from the system. That is how normally the digestive process works. So these mechanism or these safety valves are extremely important so that the gut microbiome or whatever bacteria is present in different part of the gut does not really go upward and disrupt the whole process of digestion and really causes any inflammation in your gut. This is very, very crucial and very, very important in understanding the whole process. Now, the second defense is basically the chemical defense. Various acids or various juices, digestive juices that are secreted in your gut, that also plays a major role in determining and providing the immunity for your gut, especially the hydrochloric acid. And also we have bile, and we have various other digestive enzymes. These all play a crucial role in deciding or defining the gut defense. And there is also another aspect of gut which is actually called as the motility, or basically the movement. And there are 2 different type of movement that happens in your gut. And understanding of these is very important because this is how we program a protocol around treating gut disorders. We need to understand like how we can actually obtain a healthy microbiome. And these information is very crucial to understand the peristaltic movement which happens that helps in flushing out all the bacteria from the gut outward. We also need to understand there is another particular movement called as migratory motor complex. This happens every 90 minutes, which is one of the reasons we normally say that do not snack too often, so that it actually disturbs this kind of propulsive movement. Okay, so these are very important. And talking about hydrochloric acid, we also need to understand that this is basically a safety mechanism. It is the first line of defense because these secretions ensures that there is no pathogenic bacteria, there is no microbes, there is no parasites that enter your gut. Because gut, as you know, is one of the organs, one of the 3 organs which are continuously getting exposed to our surrounding. Like we have our skin, and we have our lungs or the respiratory system, the air that we breathe in, that brings in a lot of microbes. And we also have the skin, which is getting exposed to the environment. So the skin pores can also bring in a lot of microbes in. And then finally you have the gut, which also causes, especially when you eat raw food like fruits, these are all like partially contaminated. But your gut has a protective mechanism which helps in completely destroying all these microbes and keeping the environment inside your gut completely and totally safe for you, right? So now next slide, we will see the importance of gut in defining the immunity, as we already spoke about. So these safety mechanisms need to be looked at, and one particular aspect here is about most times like we complain about indigestion, the gastroesophageal reflex. Like we talk about like burps that comes up. We talk about like all these different aspects, and there are different bacteria that are responsible for having all these different abnormalities that are part of the gut. You know that immunity normally, or the gut microbiome, is properly defined by various factors, not only once you are born, but even before you are born. The delivery mode, the mode of delivery really defines. We already know that, all of us know that, how important it is to have a normal birth. Like when you have a normal birth, the babies are born, and during the exit, they ingest a lot of bacteria from the vaginal fluid of the mother. And these are very important to create that kind of diversity and density of bacteria in the human gut. So when the babies are born by natural birth, they possess a lot of innate immunity versus they are born through cesarean section. And another major factor is about use of antibiotic, not only for the babies, but even for the mothers. These days, you know that the allergies and asthma are very common among babies, especially, like up to the 12 years of age. They go through various problems like relating to allergies or intolerance of the food, or even asthma. Childhood asthma is actually very, very common these days. And one of the major factor is because they lack immunity, because we are all very obsessed and living in a super clean environment where we have no exposure to the external pathogens. And we also don't possess these immunity like by birth. Okay. Another most important factor is breastfeed. Breastfeeding, like, as you know, there is one particular compound or component of breast milk, which is called as colostrum. The colostrum contains a lot of immunoglobulins, which needs to be put into the baby's body by the mother, which is why 6 months of breastfeeding has to be mandatory, so that the babies are gaining a lot of immunity compared to all the formula-based nutrition. And other aspects like probiotics and prebiotics, different fibers, antioxidants, multicolored food, all these different aspects are important for defining the immunity, childhood immunity. Now, going to the next slide, we need to now understand the various factors that affects the gut microbiome. The different aspects of impaired gut immunity, or why the dysbiosis happens in the gut. Dysbiosis means nothing but there is an imbalance between the healthy bacteria and the disease-forming bacteria in your gut. The bacteria that are supposed to be present in your gut are not being abundant, and you have plenty of unfriendly bacteria that are growing in your body. For example, we have something called as small intestinal bacteria, or we have methanogenic bacteria, we have Helicobacter pylori bacteria. These are all unfriendly bacteria for the human body. Whereas you have friendly bacteria, certain bacteria called as lactobacillus, bifidobacterium. These are all friendly bacteria for us. So we should be really focusing on these substances like probiotics and things like that. Earlier, I was actually talking about the structure of the anatomical structure of the human gut. We have your stomach with a pH. As you know, the pH scale 1 to 7 is actually called as an acidic pH. 7 to 14 is called as an alkaline pH. And a bacteria cannot grow in an acidic medium. It can only grow in an alkaline medium and in a sugar medium. Okay, so the hydrochloric acid that are present in the stomach makes the stomach environment highly acidic between 1 and 2, which is even acidic, more acidic than a coffee or Coca-Cola. Okay, so in this acidic environment, the pathogenic bacteria cannot grow. And when it comes to the small intestine, the pH in the small intestine is maintained between 5 and 6, which is slightly towards alkaline, but not completely alkaline. Whereas when it comes to the large intestine, it's a very nutrient-poor environment, whereas small intestine and stomach are nutrient-rich environment. Okay, so in the large intestine, we have roughly about 100 trillion bacteria that are present in the large intestine, compared to small intestine about 10,000, and in the stomach it is about 100 up to 100 bacteria per milliliter of fluid. So the large intestine is actually totally dense and diverse with the bacterial flora. So it is important for us to maintain this acidic pH in your stomach And most of the time, like, when we feel acidic, when we feel indigestion, we normally go to any pharmacies and we take the over-the-counter medicine, which are basically nothing but antacid. We don't really realize the harm that we do to our body by gulping on antacid, like, very periodically and very often, because it can completely destroy the acidic medium within the stomach, which can invite a myriad of parasitic infestation and also like a lot of bacterial and viral infections. And this is one of the major factors that we see now. Even food allergies, food intolerances are very much known in a low acidic environment. So these are, and plus antibiotic, as we said, that is also like very much important. Any inflammatory conditions in the gut, for example, like we have something called as like when you eat spicy food, extremely spicy food, normally it disrupts the gastric mucosa or the intestinal mucosa. So that is very important to avoid that completely. We also need to look at antibiotics. These are all like human-made substances, so it cannot identify your friendly and unfriendly bacteria. So it is important for us to just like really understand the usage of antibiotics and not do it like very often and for unnecessary purposes, right? So in the next slide, you will also see, which we already discussed about the different type of defenses and how it is important to just improve the motility of the intestine, how it is important to just like maintain the acidity in the stomach, how it is important to just like watch out on the digestive enzymes in the gut, which is responsible for various digestive processes, how it is important to just maintain your liver health good, so that your bile production that happens in the liver is extremely good, so that it actually helps and aids in digestion, and how it is important for us to have a proper motion so that we don't really obstruct the flow of food and we don't really also have any overgrowth of these unhealthy bacteria in our body. Now, we often experience certain gut disorders, and one of the most common one we all go through are indigestion and bloating. Why does it happen? It doesn't have to be always like a pathological condition. Sometimes it could be purely related to our lifestyle. When we eat heavy food, we naturally feel indigestion because there is no enough space inside our gut for the digestive enzymes and the juices to get mixed up with the food, because that mixing has to happen for you to have a proper digestion. We can also see that sometimes eating too fast, because this is a time for fast food. Everyone, especially in the Western diet, we know that we go for mostly the takeaway food, fast food, and we finish the food it's so fast. So we all need to practice something called as a mindful eating. This really helps because you are appreciating the food, we are appreciating each and every taste of the food, how it actually can have all the information we are gathering from the food while we are eating. And we are not really just totally defocused on what we are eating. Food allergies is actually another major factor. You need to understand, and journaling really helps here, how we write down everything that we are eating. And then we can actually understand which are the food that is actually causing the problems for us. And also various other, as I discussed earlier, like parasites, the candida infections, then SIBO, small intestinal bacterial overgrowth, and extremely fatty food, like foods that contain like a high level of refined fats. All these things are very important to completely avoid. In the next slide, I would like to discuss about the different type of dysbiosis, which we already spoke about. It could be like either in the small intestine or it could be in the large intestine. And depending on that, we can actually just find it, whether it is a small intestinal bacterial overgrowth or is it a large intestinal bacterial overgrowth. Besides having all the other problems like relating to the gut, the indigestion and poor gut health can also cause deficiency of vital nutrients in our body. This is a very, very common factor these days, that people are suffering from vitamin D deficiency. There is not enough vitamin B12, iron deficiency, or the stored iron in the form of ferritin deficiency. Then allergies, which is because of the histamine intolerance. People are getting so much of allergies with the food or seasonal allergies. And also sensitivity towards food, like gluten sensitivity. These are never heard, actually. These were never heard in the past. But these days you see a lot of these kind of conditions, which is primarily because of poor gut health. In the next slide, we speak about how we treat the gut problems. And this is very crucial. The simple step is, the first and foremost one is starving the bacteria. You need to completely starve the bacteria, which are the pathogenic bacteria, so they don't really grow and multiply. And this is purely done by removing the carbohydrate diet. And we also have killing the bacteria by using herbs and spices, which is also like possible, like that you can use a lot of, like even coconut oil can be also used for killing the bacteria. And you can also promote the motility of the intestine by adding a lot of fiber in your diet. So these are some of the most practical steps for you to be maintaining a healthy gut microbiome and be healthy. Thank you so much.